इंडिया में तो खासकर ये फैशन भी है कि जब द मदर इज प्रेग्नेंट तो आप उसको 2 लोगों का खाना खिलाते हो, ठीक है. सो यू बेसिकली एंड अप
ड्राई फ्रूट रिच,
कैलोरी रिच, पंजीरी एंड व्हाट नॉट, है ना, कि you're eating not only for yourself but for the baby, but that is not true. Normally the weight gain should be 10 to 12 kilograms when you are carrying a baby inside of you. But normally Indian women would, not all, but now because women are more conscious, but yes, majority would gain about 18 to 20 kilos. So that extra fat which you have gained will actually not go away so easily. Don't forget that as you age also, that to get rid of that fat is not easy. And then because of the pregnancy, the stretching of the abdominal musculature, जितने हमारे myofascial structures हैं, they stretch out so much that they cannot shrink back. So if they don't shrink back, you may be fit everywhere, but in the abdomen you may still have that, wrinkly look and the lax abdomen. Because जो आपके पेट और अंदर के जो contents हैं, they will push through the weakness in the abdominal wall. So they can have this bulge which many women don't like. And once you've completed a family or, you have maintained your weight for a long time, then we can give them the option of doing what is called as lipo-abdominoplasty, where we combine liposuction with the removal of the extra redundant skin. That extra skin which is there.
इसको टमी टक भी बोलते हैं.
टमी टक भी बोलते हैं. कॉमन पार्लेंस में टमी टक कहते हैं. एंड इसको आप अम्बलाइकस के नाभि के नीचे जितनी स्किन है आपके प्यूब्स तक वो सारी निकल जाती है. And you basically bring down the whole upper skin like a curtain and suture it into a new place in the lower abdomen. तो scar आपके अंडर क्लोथिंग में दिखता नहीं है. And we create a new navel for you. So it's basically a complete makeover. So many people actually use the term as mummy makeover or something like that. So you basically do a tummy tuck and you can also do something for the breasts. So there are a lot of procedures which are there. But please understand.
ये जो tummy tuck आपने बताया, this is probably the most invasive, right?
Yeah, it is one of the procedures which is, yes, more invasive.
But best results.
It gives you the best results because most women would feel that they have gone back 15 years or before they had the children.
And कितना time लगता है इससे recover करने?
See, nowadays we are using the modern technology. We are using a lot of regional blocks. So most of our patients are able to stand up the next day. ये प्रोसीजर जो मैं पहले 15 साल पहले करता था, तो पेशेंट 3 दिन बेड रिडन रहता था. घुटने में बहुत एफर्ट चाहिए होती थी. आजकल हमारे सारे abdominoplasty वाले पेशेंट्स दे स्टैंड अप द नेक्स्ट डे एंड मोस्ट ऑफ आवर पेशेंट्स आर डिस्चार्ज विद इन 24 आवर्स.
अच्छा.
पहले हम लोग पाइप्स डालते थे वो फ्लूइड निकालने के लिए सब, आजकल वो भी नहीं डालते हैं. सो दिस इज एन एडवांसमेंट ऑफ द टेक्निक, द स्किल्स ऑफ द सर्जन्स and the modern tools which are available with you, which you can use to maximize the result and minimize the discomfort to the patient.
And the risk also, minimize
risk also. कोई भी पेशेंट नहीं चाहता कॉस्मेटिक सर्जरी वाला पेशेंट कि उसको पेन हो. या आपके हाथ में चोट लगी है तो आपको पेन हो रहा है, तो आपको वो तो अंडरस्टूड है. बट आपको इलेक्टिव काम करा रहे हो तो उसके लिए आपको you want minimal pain. So we use lot of local anesthesia, long acting drugs which gives you good pain relief. And these are the patients who will then send you the next patient.
Right.
अगर उसको इतना पेन होगा कि वो 10 दिन तक बिस्तर से नहीं उठ पाई या उठ पाया तो वो आपके पास पेशेंट ही नहीं भेजेगा, बोलेगा ये तो बहुत पेनफुल प्रोसीजर है.
और ये कितने दिन तक उसके बाद रेस्ट कितने दिन का?
रेस्ट नहीं चाहिए होता है इसमें. यू जस्ट हैव टू टोन डाउन ऑन योर डेली डे टू डे एक्टिविटीज.
अच्छा. सो नेक्स्ट डे द पेशेंट कैन स्टैंड अप एंड
गो होम.
अच्छा.
या इफ अगर बाकी पैरामीटर सब ठीक हैं, most of our tummy tuck patients or abdominoplasty patients go home the next day. We put them in a pressure garment. It's kind of a tight clothing which is sort of worn by the patient. And patient limits his activities to the activities of daily living. आपने उठना चलना, बाथरूम जाना, खाना खाना, थोड़ा बहुत टहलना. You cannot obviously do vigorous exercises.
Right.
If you're into aggressive, workouts and all those things, that will start after 4 to 8 weeks depending upon हमने क्या क्या किया है. And then you build up slowly and reach that stage.
तो यानी 2 महीने में आप रिगरस वर्कआउट तक भी पहुंच सकते हो, which is like the epitome of physical activity.
Yeah. So it all depends कि हमने क्या किया. अगर मान लो कई लोगों की बहुत वॉल वीक है तो उसको हम प्लाइकेट करते हैं. तो उसमें आप फिर 6-8 हफ्ते में ग्रेजुअली स्टार्ट करते हो and then you build it up over a 1 month period. You may also have to wear pressure garments for a longer period of time. So like I said, every patient is different and it needs to be individualized as per the needs.
But today we have the technology that anyone who comes in for this kind of a complex procedure वो 2 महीने में fully recover हो सकता है. Next day उठ के procedure के next day उठ करके जो है अपने सारी routine life में वापस.
But again, I will not say blanket this thing. It depends कि हमने कितना liposuction किया है, patient का threshold कितना है, patient का बाकी weight कैसे है. So it's a amalgamation of lot of factors which are there. But yes, I would say 70 to 80% of the patients can go back home the next day.
Wow.